Assalamualaikum warahmatullahi wabarakatuh to all students and parents. So this is our online distance learning with me Abdul Kabir bin Rahmat from Faculty of Business Management and Malaysian Institute of Transport UITM. So stay at home, stay calm and keep on learning. So Assalamualaikum, hi and very good day to you all. Welcome back to our TPT552 chapter 5. So today we're going to be discussing on chapter 5, which is occupational health and hygiene. So let's check it out on what's the learning outcome. So the outcome of this study that upon completing this topic, you should be able to know the value of occupational hygiene and the role of occupational hygienists, the range of hazards in the workplace, hazard recognition techniques, source and potential routes of exposure, hazard evaluation, exposure assessment and measurement processes, methods of controlling exposure, and the management of occupational hygiene programs. So this is the references. Okay. So what is occupational health and hygiene, and how does it differ from what we have learned before? So this is actually the special segment where there are we have a position which we is called as a position which is called as occupational health and hygienist. So what do they do? Let's just check it out. So the International Occupational Hygiene Association defines occupational hygiene as the discipline of anticipating, recognizing, evaluating, and controlling health hazards in the working environment with the objective of protecting worker health and well-being and safeguarding the community at large. So this is the definition. So based on that definition, there are a few breakdowns which we can see. First is health and hygiene, where health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. While hygiene, we are talking about the conditions or practices conducive to maintaining health and preventing disease, especially through cleanliness. While risk is the likelihood that a person may be harmed or suffers adverse health effects if exposed to a hazard. Hazard is the potential for harms, physical or mentally. In practical terms, a hazard are likely to be associated with condition or activity that is, if left uncontrolled, can result to a much more injury or illnesses. While exposure means reasonably anticipated skin, eye, mucous membrane, or peritoneal contact with peritoneal Exposure means reasonably anticipated skin, eye, mucous membrane, or peritoneal contact with blood or other potential infectious materials that may result from the performance of an employee's duties. So, what is the importance of occupational health and hygiene? First is prevention of exposure, and second is to address the source of all the problems. So, in preventing to or contact with the health hazards and control health risks in the workplace environment, while addressing is by identifying the hazard and methods of contact and how to prevent or minimize exposure and or its effects. Occupational health and hygiene is about the prevention of ill health caused by work. So work, as you know, work-related mortality accounted for 5% of the global work-related mortality accounted for 5% of the global total death. So this is based on the global burden of disease study in the 2015. So the biggest share of work-related mortality came from the work-related disease, which accounted for 2.4 million or 86.3% of the total estimated death, and fatal accidents accounted for the remaining 13.7% from the WHO 2017. So what are the hazards? So there are so many hazards, especially in our workplace or wherever you are. So environmental stresses on which industrial hygiene focuses can be divided into the following categories. First, we have chemical hazards such as mists, vapors, gases, dusts, and fumes. While physical hazards are noise, vibration, temperature extremes, and excessive radiation. Biological hazards, we're talking about molds, fungus, bacteria, insects, and sewage, food waste, and water. And the fourth hazard, we're talking about ergonomic hazards, which relate to the workplace design and condition. So this is data taken from the Occupational Health Division, Department of Occupational Safety and Health Malaysia. So, bilangan kes penyakit dan keracunan pekerjaan yang disahkan hasil siasatan JKKP Malaysia bagi tahun 2019 up to month of February. So, if you can see, the highest numbers is the occupational noise related hearing disorders or HD, which total case confirmed is 331 cases. So, the overall cases we have 537. Okay, here. Okay, and so that is the highest numbers. So this is the bilangan kes penyakit dan keracunan pekerjaan yang disahkan hasil siasatan JKP Malaysia bagi tahun 2019 hingga Februari 2019. So if you see from this diagram, so we have actually as the previous slides we are seeing that penyakit pendengaran akibat bunyi dan bising dalam pekerjaan. So you can see that the highest is within the sector of pengilangan, so manufacturing, with the total cases of about 266. So others problem with noises is kuari, lombong, pembinaan, peladangan dan kemudahan. Kemudahan tu about 32. So none of this is actually reported related to transportation industry lah. So banyaknya daripada manufacturing. So next is the continuation of various others penyakit. Not that much. So pretty much on the noises too. So maknanya that part of noises is so critical in our industry lah. Okay, now let's get back to the scope of occupational hygiene. So as we saw in the definition, there are four pillars of the occupational hygiene. So this is basically the steps taken for the how you can conduct your occupational hygiene. So first you have anticipation, recognition, evaluation, and control. So what is anticipation? Anticipation involves identifying potential hazards in the workplace before they are introduced. So you anticipate, you expecting what is going to happen. That is, you anticipate on the hazards. So next is recognition. So this involves identifying the potential hazards that a chemical, physical, or biological agent or an adverse economic situation poses to health. So if you remember the first a few slides back, I talked about hazards such as chemical, physical, and biological hazard. So we need and how does that hazard have in your workplace and how it can actually possess to threat to your health, and you need to recognize that. Okay, so as example down here, we can see that chemical agents, gases, vapors, solids, fibers, liquids, dusts, mists, fumes, etc. Physical agents, we're talking about the noise, vibration, heat and cold, electromagnetic fields, lighting, etc. For biological agent, we're talking about bacteria, fungus, economic factors, we're talking about lifting, stretching, repetitive motion. So probably in the transportation industry, these ergonomic factors are much more relevant compared to others. But as you can see nowadays, during the COVID-19, we are talking about biological agents especially within the transportation industry such as air, public transportation, trains. So we are talking about the threats of biological agents, and of course, physical agents also appear in the transportation industry, and also in psychosocial factors. We are talking about stress, workload, and work organization. So definitely, I guess all of these hazards do appear in transportation industry. All right. Perhaps you can share your view later on what do you think about the threats we have in the transportation industry. Okay, the next pillars is the evaluation. So evaluation is the extent of exposure to the chemical hazards, physical or biological agents, or adverse economic situation in the workplace. So this often involves measurement of the personal exposure of worker to the hazard. So particularly at the relevant interface between environment and the body, for example, breathing zone, hearing zone, and assessment of the data in terms of recommended occupational exposure limits, or the OELs, where such criteria exist. So you just evaluate whether how to what extent does that hazards will impact to your work, right? The next is the implementation or the application of control after you have anticipate, after you have recognized, and after you have evaluate. Now you apply the control measures. So control of the chemical, physical, or biological agent or adverse economic situation by procedural, engineering, or other means where the evaluation indicates that this is necessary. So occupational hygiene therefore focus essentially on preventive approach through the minimization of exposure to chemical, physical, and biological agents in the work environment and the adoption of good ergonomic practices. So in the occupational health field, there are a number of specialist health protection disciplines other than occupational hygiene which play important role in the endeavor to protect the health of employees, customers and contractors, and the public who may be affected by the work activities. Occupational medicine, this is talking about both clinical practice as well as the nursing, and is concerned with the effect of work on health and health on work. And this involves the prevention of health problems, promotion of healthy living and working condition, as well as the diagnosis and treatment of work-related ill health. So this is the discipline. As you can see, the occupational hygiene, we have the toxicology, chemistry, physics, biology, engineering, and also law. So what are the main activities in occupational health and hygiene? So we have the anticipation of health hazard in new proposed work situations, the recognition of health hazard in existing workplaces, the assessment of health risks in the workplace through qualitative assessment as well as quantitative exposure measurement surveys, the selection of appropriate control measures for health risks, and this requires a thorough working knowledge of measures such as elimination, substitution, local exhaust ventilation. The development of tailored control solutions for unique work activities, and many workplaces require the modification and development of control measures since off-the-shelf measures will not actually work adequately. So it's a customized activities, or the engineering themselves need to go down and look and bring their specialist experts to look into how they can actually avoid dangers or hazards at the workplace. So usually, if you look at the International Occupational Health and Hygiene Association, this topic is actually pretty much technical, and there are so much engineering work and calculation involved where whenever there is hazards, so the engineer need to step in and look on how they can actually reduce the hazards. So main activities in occupational hazard continue. the investigation into causes of work-related health, assistance with occupational health-related activities such as health surveillance or biological monitoring, training and education, such as informing workers of the hazards associated with their work and training them in the correct use of control measures, research activities, which are going to improve methods and recognition, evaluation, and control of exposure. So the importance of occupational health and hygiene we have covered a bit in the front just as an additional. So disease is linked to occupational injuries and fatalities. Some occupational deaths are resulted from exposure to airborne particulates. Deaths reported from substances in the workplace, for example, lung cancer, leukemia, etc. So lower back, the last one is the physical, which is lower back pain, which is attributed to occupation. So you can actually check out the statistics from the dosh.gov.my. So now we just go through on different hazards. First, we look into the human physiology. Alright, now human physiology and occupational disease. So human body is actually a complex organism which can be affected greatly by chemical and physical hazards to the body and has many ways of regulating itself when exposed to hazards. So we need to control this, and there are a few things that we need to consider. First is skin, musculoskeletal system, and nervous system. So these three systems of our body need to be considered. The sensitivity of our skin, musculoskeletal system, and nervous system. So there are a few listed hazard or results or harm which can occur when we are exposed to some problems. For example, skin, we might get dermatitis, physical damage, biological agents, and also cancer. So the next is endocrine system and respiratory system. We'll talk about muscular system when we are exposed to dust mites and any kind of allergens agents. And nervous system, we're talking about circulatory system and also our eyes. So next knowledge is about the toxicology. Toxicology is the study of the adverse effects of substances on living organisms. So industrial toxicology is actually concerned with the adverse effect on workers of substances handled in the workplace, although interest usually extends to adverse effects on products, on consumers, and of workplace influence on the general public. So every substance is toxic. They are capable of producing adverse effects under some conditions of exposure. Occurrence of toxic effects depend on dose. So in general, usually high doses or exposures will, in a long time or periods, will actually cause much more issues or damage. So what is the definition of toxic substances? So toxic substances is one of substances which have negative effect. Okay? So toxic effects are a function of several factors which include route of entry. It will actually destroy the properties of route of entry, your nose, your mouth, your lungs, your ears, amount of the dose and level of exposure, resistance of the individual to the substance. So that will be the effect, and response can vary widely and might be as little as cough or mild respiratory irritation, and some might have a problem of serious unconsciousness and also immediate death. So how the common route of entry, which include ingestion, injection, skin absorption, and also inhalation. So inhalation, we're talking about airborne toxic substances, for example, gases, vapors, dust, smoke, fumes, aerosols, and mists can be inhaled or breathed lah. You sedut nafas benda tu, and pass through the nose, throat, bronchial tubes, and lungs to enter your bloodstream. So amount of the inhales depend on the concentration of the substance. Sometimes when you have a small results, but the number of toxicology within that substances is high, so it also depends on the how long do you actually breathe or inhale those materials, and your exposure and your breathing volumes. So inhalation is particularly important due to the rapidity with which toxic material can be absorbed in the lungs lah. So pass into the bloodstream and reach your brain. Inhalation is the major route of entry for most hazardous chemicals in the work environment. Next is absorption. So this is the second most common route of entry in an industrial setting. So passage through the skin, and then after you masuk dalam skin, dia akan masuk dalam bloodstream. So or any of your unprotected cuts, luka-luka, sores, kudis, abrasions facilitate the process, but healthy skin can also absorb certain chemicals. So body parts differ in absorption capabilities. So some may absorb pretty much faster. Some may resist to absorption. The forearms have a low, and some people, the forearms have a lower absorption potential than the scalp and forehead. So you punya kepala ni, dahi ni cepat nak serap toxic. Next, ingestion. An injection substance is swallowed, masuk ke mulut, moves through the stomach into the intestines, and from there into the bloodstream. Maknanya dah masuk perut, diproses, dia masuk dalam kita punya sistem badan ataupun darah. So toxic agent can enter the body when accidentally consumed by workers when you are eating your lunch, breakfast, snack, dinner, whatever. So airborne contaminants can also rest on food or hands, as a result be ingested during a meal or snack. So always remember to wash your hand when you handling your materials at your production line. So it is critical to confine eating and drinking to sanitary areas away from the work site. Sometimes orang ni tak sabar lapar makan, ataupun the pantry are just close nearby to their area which have lots of chemicals. So actually this is dangerous because the fumes sometimes habuk-habuk ni dia terbang go into your foods, and then you makan, you terus sakit perut, terus sakit macam-macam lah. So it is critical to confine eating and drinking to sanitary areas away from the work sites and ensure that workers practice good personal hygiene. So make sure you wash your hands thoroughly before eating or drinking. The next is the injection, which the introduction of substance into the body by way of needle and syringe, compressed air, high pressure hydraulic leaks, and not often a route of entry for a toxic substance in the workplace. Lain kalau orang tu jarang lah tiba-tiba you nak tu cucuk benda kan, melainkan ada orang saja cucuk je kan. So what is the effect of toxic substances? First is the effect will be berbeza-beza from different person one to another, and acute effects and exposure involve a sudden dose of a highly concentrated substance. They are sudden, severe, typical, involve just one incident, cause immediate health problems, and are not the result of an accumulation over time. Chronic effect exposure involve limited continual exposure over time, and health problem develop slowly. So progressive accumulation of toxic substances in the body and progressive worsening of associated health problems, and little or no awareness of exposure on the part of affected workers. So part of the liver function is to collect toxic substances, convert them to non-toxics, and send them to the kidneys for elimination of the urine. So when the dose is more than the liver can handle, so toxic akan merosakkan you punya sistem badan. So this is the selected toxic substances and organs that they may endanger the most lah. So kalau you tengok benzene, carbon monoxide, arsenic, aniline, and toluene, dia boleh merosakkan you punya darah. So mercury, chloroform boleh merosakkan kidney. Apa tu? Aniline. aniline, misalkan dia punya heart, lead, mercury, benzene, manganese, nak sebut pun payah, manganese, acetaldehyde akan merosakkan brain, cresol, ice, acrolein, ice, benzyl chloride, ice, butyl alcohol, ice, nickel, phenyl, trichloroethylene, skin, asbestos, chromium, hydrogen sulfide, mica, nitrogen dioxide will actually destroy your lungs, chloroform, carbon tetrachloride and toluene will actually destroy or make your liver malfunction. So how are you going to control exposure of hazard at your workplace? First is administrative control. So you need to eliminate, reduce exposure by developing and implementing effective training policies, processes, procedures, practices, and safety rules. So next is by using the PPE ataupun personal protective equipment. So eliminate, reduce exposure through personal barriers. The next is engineering control by limiting exposure at the source in the preferred way to protect workers through the substitution in using less hazardous substance, isolate, ventilate, and also use protective clothing. So this is the example of chemical hazards. We have dust, fumes, smoke, aerosols, mists, gases, and vapors. So for airborne contaminant, of course, it is in the form of dusters lah. So they are various types of solid particles produced when a given type of organic or inorganic material is scraped, sawed, ground, drilled, handled, heated, crushed, or otherwise deformed. Maknanya kalau dekat kilang you tengok lah, bila orang using the saw, dia keluar habuk kan. Bila dia potong benda, keluar habuk. Bila dia pecahkan benda, keluar habuk. Bila dia proses benda, keluar habuk. Bila dia angkat barang guna ataupun letak barang, keluar habuk. So these dusters yang terbang-terbang ni adalah airborne contaminants. So the most common causes of fumes are also welding. Welding pun boleh menyebabkan fumes. Fumes ni maknanya bila dia pateri, dia keluar asap. Asap tu you hidu tu bahaya sebenarnya. Heat treating, maknanya bila you panaskan sesuatu, dia keluar dia punya asap. Asap tu bukan asap biasa, asap yang contaminated, maknanya dia beracun. And metallizing, another one is metallizing, which involve the interaction of intense heat with a parent material. So heat volatilizes portions of the parent material, which then condense as it comes in contact with cool air. So the result is the formation of a tiny particle, so yang you boleh inhale. The next is smoke. So in result of the incomplete combustion of carbonaceous materials, leaving tiny soot or carbon particles remain in the air which can be inhaled. So adik-adik yang tadi tu lah, cuma ni bakar tu asap lah. Aerosols are liquid or solid particles so small that they can remain suspended in air long enough to be transported over a distance. So aerosol ni macam ni lah, kita punya bak nyamuk sebagainya. Bila kita spray, dia boleh terbang merata dan stay dalam air for quite a long time, and it's actually berbahaya lah. So next we have mists, which are a tiny liquid droplets suspended in air, and they are usually formed in two ways. Satu, vapors return to a liquid state through condensation, so kondensasi, and when an application of a sudden force or pressure turns a liquid into particles. Next is gases, are actually formless fluid, particularly hazardous when they fill confined and unventilated space. So the most common sources are from welding and the exhaust from internal combustion engines, and certain materials that are solid or liquid at room temperature and at a normal pressure they can turn into vapors when heated or exposed at normal pressure. So barang ni macam dia punya sifat dia. Ada yang bila dia tak ada apa-apa, dia keras. Bila dia panas sikit, dia akan jadi fumes ataupun vapors. Okay, next is we go to the biological hazard. So biological hazard ni macam sekarang ni, virus, bacteria, fungus and other living organism that can cause acute and chronic infection when it come into your body. So now the famous one is corona. In occupational where there is potential exposure to biological hazard, workers should be practiced using the right equipment lah. Next hazard is physical hazard that employees in the workplace face include excessive levels of ionizing and non-ionizing electromagnetic radiation, noise, vibration, illumination, and temperature. So, in occupation where there is exposure to ionizing radiation, time, distance, and shielding are important tools in ensuring employee safety. So, danger from radiation increases with the amount of time one is exposed to. So, hence the shorter time exposure, radiation danger. So, ni biasa kalau you kerja macam kat Sirim kan, dia ada mesin-mesin yang dalam tu ada radiation. So, I ada pernah case satu once which related to my cousins. So, my cousin dia punya husband, bapa husband itu is dulu scientist. So, they bring in one machine from America. So, machine ni dia pakai, dia high radiation. So, somehow dia macam mana entah dia affected the brain lah. So brain dia ada macam some sort of cancer. So dia sekarang ni dia lumpuh dan dah tak boleh bekerja lagi lah. So noise is a very significant physical hazard, can be controlled by various measures. So radiation hazards are increasingly prevalent in the age of sekarang lah high technology, makin banyak berlakunya radiasi. And 5 kinds of ionizing radiation, kita ada alpha, beta, X-ray, gamma and neutron. Alpha radiation is least penetrating, which makes shielding simple. The others are more difficult to shield against lah. So meters and other instruments are available to measure radiation levels in the workplace. So the greater risk of non-ionizing radiation in the modern workplace comes from lasers. Okay, now we're going to talk about the pressure hazards. So pressure extremes are potential workplace hazard, definitely. A common troubles encountered by workers under compressed air is pain and congestion in the ears. So from inability to ventilate the middle ear properly during compression and decompression, workers subject to increased air pressures can suffer temporary or permanent hearing loss. So ni bila ya ada ni macam-macam ya. Kalau you kerja offshore, you kena dive in dalam air if you are divers, ataupun engineering yang perlu scan the pipeline into the sea, they are actually dealing with pressures lah. Sama juga orang yang selalu pramugari atau pramugara di airlines, so dia ada pressure jugalah. So effect of reduced pressure are much the same as the effect of decompression from high pressure. So if pressure is reduced too rapidly, dia tak boleh cepat-cepat pressure ni reduce, dia boleh berlaku decompression lah. So decompression sickness and ear disturbance similar to the diverse condition can result. So bila you di bawah laut dalam, you nak naik atas, you kena naik slowly bagi dia decompress perlahan. Kalau you immediately decompress, you punya gegendang tu boleh meletup. Tu kadang-kadang ada orang bila dia go for deep sea diving, bila dia keluar immediately je, dia tak ikut prosedur yang betul, ataupun dia tak masuk dalam decompression punya room, akhirnya dia boleh mati terus lah. Maknanya dia keluar, dia punya telinga gegendang terus meletup. Next is agronomic hazards. So it's actually the science of agronomic studies and evaluates a full range of tasks, including but not limited to lifting, holding, pushing, welding, and reaching. So many agronomics problem results from technological changes such as increased assembly lines, speeds, specialized tasks, increased repetition, and poorly designed job tasks. And of this condition can cause agronomic hazards such as excessive vibration, noise, eye strain, repetitive motion, and heavy lifting of objects. So improper design tools or work can actually become the agronomic hazards. Agronomic hazard can be mitigated by applying a good design to your tools, equipment, for example seat, tempat meja duduk, tempat menulis. So this is we can refer to the Guidelines of Shipyard Ergonomic for the Prevention of Musculoskeletal Disorders, OSHA 2008. So ergonomics is actually a multidisciplinary science that seeks to conform the workplace and all of the physiological aspect of to the workers. So ergonomics involve the following: satu, using special design and evaluation technique to make tasks, objects, and environment more compatible with human abilities and limitations. So it basically involves seeking to improve productivity and quality by reducing workplace stresses, reducing the risk of injuries and illnesses, and increase efficiency. So yalah, bila you the idea is to sama ada you make sure that productivity. So at the same time you make sure that pekerja pun badan dia tidak sakit lah. So ergonomic hazard are conditions that require unnatural postures and unnatural movement. So bila you ada pergerakan yang luar biasa, you ada pergerakan atau kedudukan bekerja yang tidak sepatutnya, yang tidak sesuai, posture yang salah, so it can actually becoming the hazards, and which is the ergonomic hazards. So the human body can endure limited amounts of unnatural posture or motion. Dia tak boleh lama-lama, dia kejap je, but repeated exposure to such condition can actually lead to physical stress and injury. So what are the problem solving strategies? Is back, neck, shoulders, and lower leg pain, and often associated with seated repetitive work on light parts, and you need to modify the job and workstation. So rotate the workers. Satu caranya ialah rotate seated workers with larger parts involve interacting with objects that may be too large and manipulated manually, associated with the assembly and welding jobs, and problems are typically related to your posture, illumination, reach, and lifting. So the problem solving include the use of technology. Maknanya angkat barang gunakan teknologi, gunakan belt yang boleh untuk jaga backbones, and of course you need to have the right position, work for easy access that does not require bending, twisting, and reaching. Use supplemental lighting. Make sure that your workplace is have enough lights, and use adjustable chairs and or work surfaces. So next is you can also have a control for your seats, and use the wheels, levers, knobs, handles, buttons to control your process system or equipment. Use the adjustable swivel chair with inflatable back and seat support, and keep both feet on the floor. So provide comfortable, convenient location for controls. So most jobs performed while standing do not involve a great deal of motion, but involve the handling medium to heavy materials. So physical stress includes your leg, arm, and back strains. Occasionally, side strains occur when you're bending or twisting. Okay, ni lebih kurang je. So adjust machine, make sure that they are recessed. Lepas tu machine with easily controls dia, senang nak capai control. Ample free space around machine is also important, that to make sure that you can walk around, sekeliling your workplace. So tak tercegat berdiri je sama lama-lama, so itu akan actually merosakkan. Okay, next is the ergonomic problem is that you have hand tools introduce a variety of potential hazard intelligence to the use. So most commonly ialah carpal tunnel syndrome and muscle strain of the lower arm, hands, and wrist. Tools designed to keep hands in the rest position. So maknanya tools, you ada satu tools yang selalu membuat tangan you tak bergerak banyak ataupun rest in one position. Select tools with thick rather than thin handles, enhance gripping surfaces such as knurling, feeling. Eliminate twisting by selecting tool designed so that the direction of movement or function is the same as the direction in which force is applied, or by using technology. So select tools with handles made of hard, non-permeable materials that will not absorb toxic liquids harmful to skin. So ini gambar rajah of you tengok ada degree-degreenya tu. So degree is actually what have been studied about the right positioning of your body. Next is the psychosocial hazards. psychosocial hazard ni apa benda dia sebenarnya? Work stresses, ya, sebenarnya dia salah satu work stresses that affect the psychosocial and physical well-being of workers, including their ability to participate in the work environment among other people. For example, include body stressing, bullying at workplace, aggression by the customer, fatigue, remote or isolated work-related mental stress. So to control this hazard, employer could offer counseling, help, training to improve work-related skills, favoring the healthy lifestyles. So ni apa kecil sangat ni? So this is basically emotion affected in the working workplace by social, occupational environment and psychosocial factors we perceive as stress. So stress is the reaction of the human body to the stimuli. Okay, just skip this part. So these are the sources of workplace stress: physical working condition, work overload, role ambiguity or conflict, lack of feedback, personality, personal and family problems, a job perceived as being too complex, repetitive and monotonous, control of employees over their job responsibility and being responsible for work without being in control of it. So these are the sources of workplace stress. So what are the reaction is, satu ialah subjective or emotional. So berlaku anxiety, aggression and guilt. Behavior, ni sama macam teori, hari tu kita belajar teori of Heinrich exam theory. So dia akan somehow behavioral, so prone to involve in accident, trembling, and the next is cognitive, physiological and organizational. So there are three stages of human stress response. Satu, alarm, characterized by pulse, sweating and increased heart rate, which prepare the body for whatever action is necessary. And next is resistance. Alarm symptoms dissipate and the body develops a limit adaptation to stress. And lastly is exhaustion, penat. Failure to adapt to the continued stress can be seen as the psychosomatic diseases such as gastric ulcers, colitis, rashes and autoimmune disorders may begin lah. So what are the factors associated with physical stress? Sitting versus standing, stationary versus movable atau mobile, large demand for strength power versus small demand for strength power, good horizontal work area versus bad horizontal work area, good vertical work area versus bad vertical work area, non-repetitive motion versus repetitive motion, low surface versus high surface contact and non-negative environmental factors and negative environmental factors. So these are all the factors which associated with the physical stress. So ni the benefits of ergonomics. Ini kita dah go through juga. So now we look into the potential health hazards in the transport sector. So the first one is risk. We're talking about physical work factor, harassment and violence, work organization factors and working time. Next is the outcomes. We're talking about accidents lah, work-related health problems, musculoskeletal disorder, asbestos-related diseases, noise-induced hearing loss, fatigue, and other cognitive health problems. So this is one of the example in the container terminal. So for example, key crane incidents. Key crane ni tahu kan, the machine ataupun the heavy machinery which to crane for picking up the containers. So next is rain flood damage, straddle carriers, wrist lift truck. So all these are within the container terminal. Apa dia punya moving object, moving machinery, moving vehicles that can pose threat to your life in container ports. So that's just about it. So wait for some instruction in my for the full videos. Right? Thank you.